Hannah Nelson. I'm a project administrator at Michigan State University in Grand Rapids, Michigan.
I'm Celeste Sanchez-Lloyd, Program Manager for Strong Beginnings Healthy Start in Grand Rapids, Michigan. So within Grand Rapids, Michigan, I have the privilege of my community and our very close relationship with providers that come in various titles, from LMSWs to community health workers to OBs to public health officials. And so our broad community of individuals who are interested in impacting the work of maternal child health is quite diverse when we're talking about my community. I have the privilege of being program manager for Strong Beginnings, and a lot of my day-to-day is actually implementing the work and the community conversations, the community input that's being taken at the table to real-life circumstances and situations with the participants we work with.
Like Celeste said earlier, our community has a lot of different providers from different spaces, and we've had the opportunity to implement a lot of different programs that have been able to create change. Differences from the CDC's Hear Her campaign to interventions to help folks understand what high blood pressure means and ways to manage it if they have it. And having people at all those different levels has really given us representation of what both the community can do and how the community is represented and who's there.
So what's a lesson learned through this journey of AIM CCI Pilot Site? I would say that for many times, or for oftentimes, it's about sometimes you have to slow down the process. We get really excited about moving quickly and recognizing that not all partners might be at the same speed. And so slowing down the process, making sure that you're having active communication with your partners, your community members, your stakeholders, so that there's a well-depth of information that's being spread back and forth, but also that the consistency of communication is established.
To build off what Celeste was speaking in regards to lessons learned, I think really understanding that every community partner has many projects and their priorities may not always be the same as our priority, and recognizing that not to take that personally, to really hear what they're saying and to understand that sometimes just slowing down and working with partners to help them where they are and to help them get through the challenges they're experiencing and being able to pick things back up once they are in a spot to be able to give the resources that we all need.
Yeah, so when we're talking about other groups or communities that are interested in starting AIM CCI bundles, I would suggest that some strategies to kind of put in front of you are making sure that you have a well-versed community that's interested in this topic, making sure that you're involving stakeholders from various levels within your community. To Hannah's point mentioned earlier, making sure that you're patient. This is work that you need to be patient, and you have to recognize that there are different levels of priorities amongst the community. And the last one, I think, is just recognizing that we're all in this for the same common goal, and that we really want prenatal care, postpartum care, and infants that we're working with to have a successful outcome. And so if we can unify in thought, we can lead ourselves into the goal. And so really just being patient.
For communities that are looking to get started in this work, I think that it's important to really take an assessment of what resources and skills you have in-house, and maybe even because you have someone who typically is working in a data space, it doesn't mean that they aren't also good at graphic design. You might have people that have interests in totally different spaces that you never thought about, but being able to harness that and be creative, I think that also does apply to data, in that you're likely already collecting it for a different grant, a different project, you're collecting it for your own purposes in some way. Being able to use the data you're already collecting can be a great way to get information out there and help create change without putting an additional burden on folks, either the patient, even patients, clients, or providers. One of the things AIM CCI could do to improve would be focusing implementation and piloting some of these bundles and their elements in rural spaces. Currently, they're being focused within an urban environment, and that information could be very useful and applicable to many folks who are not living in those urban spaces.
So as we talk about areas of improvement, I think there's always an opportunity, not just for AIM CCI, but also for the pilot sites, to reflect on what doesn't work, where are weak spots, and highlight those. So often we love to hear the wins and the gains, but really digging deep around where are we really doing the most disservice? Where have we maybe lost some opportunities? How do we make sure that we're capturing community voice to reflect on where we still have gaps? And so that's an area where I think we can continue to bring forth on some of our blind spots. So one of the blessings of this work is really capturing community voice. I've been just astounded with the community response, from provider levels to actual community members and participants. The willingness of our women, our father, our birthing individuals who are willing to share their story so that it can impact the work that we're doing to make true change has been just astounding. We've been able to really hear great testimonials of the great work that Strong Beginnings Healthy Start is doing, but also has been able to lend us some opportunities for us to grow. And so it's been a great experience, and it's something that we find very valuable moving forward.
Building off what Celeste was saying, the community voice is the most important. And it can be really easy in this work to get very focused on the day-to-day tasks, and if that report didn't get turned in, if your Excel sheet is not working correctly, someone's not responding to emails. But I think that it's really important in those situations to be able to step back and remember why we're here. Why are we doing what we're doing? And taking the time to think and remember the community. That's why we're here.